Can you all, oh, there we go. Good morning. I had to check. I'm coming from the East Coast. I was like, is it morning or afternoon? We're going to go ahead and get started. Some people might still be drifting in, but thanks to all of you for attending today's panel, The Future of Sports Injury and Athlete Safety. A little bit about who I am. My name is Stephania Bell. I work for ESPN. I'm a senior writer and an injury analyst, and that means I talk about injuries and what they are and how they're managed. And my background is actually as a physical therapist initially. I practiced for nearly 20 years, most of those in the Bay Area. So it's wonderful to come home, and everything about this summit is right at the heart of what I am passionate about. So I'm thrilled to be here to be able to moderate this session for you this morning. Let's start by kind of setting the stage for why we're talking about this, even though I think it makes a lot of common sense to everyone. But actually, I'm going to interject. Did anyone see what happened last night in the NCAA women's tournament? For those who might not have seen, Juju Watkins from USC went down and tore her ACL, and her season is now over. And here she is, a star for that team. Clearly, they're in the midst of a push in the NCAA women's tournament. Very sad news, but unfortunate as it might be, it really kind of underscores the need for us to be talking about what we're talking about today. At the Project Play Summit in Colorado Springs, the Aspen Institute, in partnership with HSS, which is the Hospital for Special Surgery in New York, and Players Health, announced the formation of a national ACL injury coalition. And this group of experts, sports governing bodies, and healthcare partners has been working diligently to develop insights and guidance around reducing the risk of serious knee injuries in youth athletes. Here are some of the things that they've learned. The data collected over a 15-year period from 2007 to 2022 by athletic trainers looking at high school athletes showed a 26% increase, 26% in the annual ACL incidence rate over that time period. The rates are highest among girls overall, which doesn't come as a surprise to many people. This is really, we've seen this explosion of ACL injuries in young female athletes in particular. But particularly in the sports of soccer, which is where it's the highest for girls, followed by basketball and lacrosse. And in boys, the highest incidence rate is in football, also followed by soccer and lacrosse. Now, if you sense a theme there, these are agility-driven sports. So a lot of change of direction, deceleration, things that put the ACL in a vulnerable position, and ultimately that's where the failure occurs. And here's a fact that should really scare the you-know-what out of everyone. In lacrosse for girls, since 2008, the ACL incidence rate has risen over 80%. So another high-demand agility sport, we're seeing a huge surge in these injuries. So what does that mean for other sports that might be coming down the pike? One thing we've been talking a lot about here at the summit is flag football, which is fantastic because it's opening football for girls and for boys across the country. I always wanted to play football. I'm really jealous that I don't get to play organized flag football, but it's an agility sport. And with increased participation in sports comes increased injury risk. So we have to be mindful about how do you try and prevent injury when you can. How do you mitigate the risk? And then if you do have an injury, because injuries are going to occur no matter what, regardless of how well prepared you are, how do you expedite the care and make it an efficient pathway for an athlete to get seen effectively and within a reasonable cost paradigm? We know that ACL injuries aren't the only injuries, but we do know that the lengthy recovery time for an injury like that is often, in addition to the trauma for the athlete of just going through the process, when you have a lengthy recovery, like 9 to 12 months on average for an ACL, there's a mental toll that it takes on the athlete. They're often separated from their teammates because they're rehabbing elsewhere. They lose that connection with the team, and obviously it's their time away from the sport. It can also present a financial burden for families, particularly when you're talking about lengthy rehab courses, and they may not be able to finance that care. And then there's not only the immediate issues from the injury and their resolution, there's the long-term consequences as well. We know that there's a 6 times greater chance of having a second ACL injury after an initial injury that requires surgery. 6 times greater within the first 2 years. And we see it happen all the time. The other thing is that you can have long-term consequences into adulthood and beyond because of trauma that occurred with an initial ACL injury. It can set you up for early arthritis, and that can limit your ability to participate in sports beyond youth, just into wellness as a young adult and even an older adult. So with all of that context around it, and again, we emphasize ACL because we have a lot of numbers there and a lot of data around it, but it really applies to any of these serious injuries in youth athletes. So I'm lucky to be joined by all the experts who are going to fill you in on what they are doing right now to try and manage this problem and give you some ideas about resources that you can utilize to help you in your organization look at injury prevention, risk management, and then effectively accessing care for your athletes. I'm going to start today by introducing Dr. Bert Mandelbaum. We're so lucky to have him here. He's going to come up and join me for a few minutes of conversation. Dr. Mandelbaum is renowned in the world of orthopedic surgery and knee injuries in particular, and has too many accolades to mention, but he is the director of the Orthobiologic Rehabilitation Orthobiologic Center in Santa Monica. He is in the orthopedic surgery department at Cedars Sinai, and he's been affiliated with numerous soccer organizations within MLS, Chivas, and youth athlete soccer organizations all over the country, and he is very closely aligned with MLS and looking at injury and resolution there. So please welcome Dr. Bert Mandelbaum.
Great to be here.
All right, I'm gonna come join you.
Come join me.
I'm gonna come join you. This is our intimate fireside chat. See, that's how we go from podium to fireside chat. So it's lovely to see you. Thanks for coming today.
Great to be here. Project Play, one of our loves overall.
I think, I kind of set the tone with some of the data, but what in your mind makes ACL injury a public health crisis?
Well, Stephania has really layered out the sequence of what I call the ACL syndrome that's going on. The incidence, 26% in the last decade, 5 to 6 times greater re-injury status, and then the consequences of that subsequent to that. It's amazing, and we can't underestimate this. It's interesting, in the 90s, we were seeing 80% were male injuries, and it's flipped to 80% female injuries. And it's happening not just in our country, now globally. And people are coming to folks like us and Holly and saying, how can we help? It's a big problem globally now. We've been at it since the 90s. A couple of concepts. One is the burden of injury is so significant. As Stephania said, it's a year, 9 months to a year, maybe not even that. And then they're at risk for the re-injury. We call that play span. And what happens in this ACL syndrome is that it takes you 9 or 12 months. Take that right off the top. And then after that, what happens to these young athletes? The young athlete, it's been shown that sometimes up to 2/3 quit after a few years. We know that we can get back 2/3, but they quit after a short period of time. In the professional athletes, whether it be in the NBA or the WNBA and professional soccer, we know there's a tail off in terms of participation, goals, practices, and the career. Hence, play span really begins to decrease. And the last consequence, as you touched on, is osteoarthritis. And we'll talk about as a healthcare concern, because there have been several studies showing that if you have osteoarthritis less than 40, and if you tear your ACL at 16 to 18, the probability of getting osteoarthritis by age 40 is above 40%. If you're one of those, the risk of dying early from cardiovascular disease goes up 1.53x odds ratio. So connecting that ACL injury to that young female, wherever they are in the world, to this public health crisis with cardiovascular disease is significant. So it's not just, can she play again? Will she play again? She plays with less performance, or he plays with less performance. But now we have a public health concern, and an increased risk of cardiovascular disease.
I think one thing it would be helpful for people to understand is the connection between why you're at such risk of developing osteoarthritis from an ACL tear.
The concept of ACL tear and our collagen genes is connected. It's connected through the collagen 1A, 3A system. It's been shown in Polish soccer players that of the group who tear their ACL compared to non-soccer players, they have a higher incidence of this collagen 3A. So with that, the collagen is a little bit defective. Hence, when you've seen this in practice, you have a daughter, a son, a father, a mother that are linked genetically. And what happens is the ACL injury is a catabolic injury, releasing enzymes, metalloproteinases, and other things at the time of injury, begins to injure the cartilage and sets up a catabolic series of events over time that results in osteoarthritis.
I think that's important because I don't think that's really recognized as a long-term consequence. What would you like to see change the most if you could wave a magic wand in the approach to this injury?
You know, back in the 90s when Holly and I first got involved in this, we said we've got to prevent this injury. It's occurring all too frequently, 1.6 per 1,000 hours of exposure, versus others that could be between 0.1 and 0.2, 1.6 times per 1,000 hours of exposure. So we developed a prevention program. At that time, we called it PEP, simply stated, Prevent Injury, Enhance Performance, and subsequently we evolved it to the FIFA 11+. It's been studied in 2 major randomized controlled trials, level 1 studies, showing 70% or more probability of reduction of ACL injury, in addition to statistically decreasing the rate of injury. So if I had to wave my wand, I would implement ACL prevention in every league, in every athlete, globally.
That's a great setup for we're going to tell you how you can all be part of, getting Bert's magic wand waved. So, Dr. Mandelbaum, thank you. I'm going to let you be excused for a few minutes. You'll come back for the Q&A. Thank you. Over here. And now I'd like to bring up the rest of our awesome panel. I'm going to start with Holly Silvers-Granneli. You heard Dr. Mandelbaum reference Holly many times. Holly is a board-certified physical therapist, yay, PT, specializing in sports and ortho rehab in Santa Monica, California. She plays a key role in research with the U.S. Soccer Federation, Major League Soccer, now the NFL, and FIFA as well. So thank you, Holly, for joining us today. Next, I'd like to invite up Jimmy Russomano, who is the Assistant Director of Athlete Health at the Hospital for Special Surgery in New York. And he is going to tell us about implementing all these training programs and the incredible success that they've had in partnership with the Aspen Institute. Next up, Charlie Wund. And Charlie is the CEO, can't read my own writing sometimes, of Injure and the founder of that, and the American Sports Insurance Services. So when it comes to risk and also understanding how to access healthcare efficiently for your athletes, Charlie's the expert on that. And last, but by no means least, is my good friend, Dr. Cindy Chang, who is the Chief Medical Officer of the National Women's Soccer League, Professor Emerita at UCSF. You only get that title if you're super, super smart. She chairs the California Interscholastic Federation and Sports Medicine Advisory Committee, and she does a lot of other things too, but I think you will agree by the time this is done, her energy is infectious, and hopefully you can take some of that away with you today. So, without further ado, let's get to some questions. So I can look at all your pretty faces. Holly, let's start with you. What is, we hear about the data. We know you've been working on this for a long, long time. What is the current state of the state when it comes to research?
That's a great question. We've really been working at this for a quarter of a century since I met Bert in 1999, and interestingly, and sort of full transparency, my brother-in-law was one of his patients, Tony Miele, who was a goalkeeper for the U.S. men's national team, and tore his ACL. I had just graduated PT school, and we went into Bert's office, and I'm like, let's write a grant, let's prevent it, and here we are. And we're still fighting the fight, unfortunately. But I think our biggest obstacle right now, and that's why we're so pleased to be here, because I think all of us scientifically have worked so hard to develop something that works. We know that they work, but we know they have to be utilized, which sounds very commonsensical, doesn't it? But our compliance and our adherence and our coaching adoption of what we've done scientifically is not quite where we want it at this point. So I speak to coaches like, you're our ambassadors. Like, we need you to go out to the fields and just basically implement what we have worked so diligently to develop scientifically. These programs are free. They require no additional warm-up. We've tried to remove as many obstacles as we could when we were thinking about the design of these programs. We have an app that we developed with the IOC called Get Set. You can download that freely, and you can have a captain run it. You can have your players run it. So we've just tried to be very thoughtful in our approach, but really it's the compliance and the adherence that suffers. So that, unfortunately, the players aren't the recipient of the benefit of all this injury mitigation. We know we can't prevent them all, but if we can reduce risk scientifically from anywhere from 72 to 88%.
That's incredible. That was the number I was going to ask you for. Was, people might think, well, it makes sense, but numerical data like that, when you're talking about reduction by 70, what did you say, 72
to 88
to 88%. I mean, if you could do that for your athletes, why wouldn't you want to do that, right? But as Holly said, implementation and adherence to the program is one of the hardest things. And Jimmy, I'd like you to talk about that, because this is where you've had a lot of success in working with coaches. And can you elaborate on that for us?
Sure. My favorite quote about coaching, I think it's a Nick Saban quote, is if you're not coaching, you're letting it happen. And I think a lot of coaches, when you watch a practice, do so well at coaching their athletes, through a drill or, some sort of a simulation on the field. But when you watch a warm-up being delivered, maybe they'll say the exercise and then let the athletes sort of go about doing it on their own, and there's no coaching. But if you go into a PT clinic, every single repetition is coached by a physical therapist. And so we know coaches know how to coach. They just don't know how to coach the warm-up. They don't know how to teach exercises. It's not that hard to teach some of these fundamental exercises. So our focus for the last 8 years or so has really been on teaching coaches how to be more confident in their skill set and understand that just by watching the way an athlete moves, you can give some really simple feedback that will have these profound effects on their injury risk.
Are there any particular strategies that you've seen be particularly effective in implementing change of behavior for these coaches to get them to adopt this?
Yeah, I think hearing the message really that you led off with, some of these statistics, is probably the easiest way to grab them in, to get them to sort of picture, that what we did early on, which was probably a little bit gruesome, and we had to learn our lesson, was we showed videos and pictures of the injuries happening. But then even worse than that was
scared straight, right?
We showed videos and pictures of drills through young athletes' legs having their ACL reconstructed. And we showed the coaches that, while here you see this terrible situation on the field, it only gets worse over the next few months. Your student is going to miss class because they need to go to PT, and they're going to be depressed, and their grades are going to suffer, their social connections are going to suffer, their athletic identity is going to disappear, and sort of make all those connections that you as the coach are really the person who can deliver this program that is going to sort of maintain all of those great things in this person's life. And if that's taken away from them, what service have we offered these kids? And so that's really been, I think, for us, the most important part is getting their buy-in and helping them understand that you are the critical piece in this problem.
That's great. And obviously you've had, like I said, you've had a lot of success with that. Now it's just, we just need to continue with the broader delivery. Charlie, I want to shift gears a little bit with you. We know it's about having people present when the injuries happen. We know that we need athletic trainers. We know that we don't have enough athletic trainers to staff all the programs, the schools, the organizations, the tournaments we hear about. What are you doing in this innovative space of yours to help meet that demand?
Yeah, I think we're, primarily, when we hear people like Bert and Jimmy and Holly talk about, we know that there's a problem. There's a system that's been in place for a number of years, and a lot of it is kind of a blind eye to what's going on. Athletic trainers are the specific healthcare professional that we know are effective in this environment. And so what we're trying to do is scale that model. We're trying to find ways that we can get that professional there to support a lot of these coaches who feel like they're not the health expert, they don't have the appropriate training, maybe they're not confident with that. There's somebody here that we can actually put in place that can help them design that and give them the support they need to feel confident on the field. But then after the injury, it is more of a triage. We talk about the life after the injury. How do we take this particular athlete and put them into a healthcare system that can speed the recovery as quickly as possible? We hear over a year, potentially. We know that this is a susceptible moment for any athlete, and we want to make sure that we can be as thoughtful as possible to put them into the healthcare system in the right place, the right provider, right care, as quickly as possible. Been proven to reduce the recovery time, the onset of re-injuries, et cetera, et cetera. So, and of course, costs, which are a major burden and a huge issue for the families that are involved in that. So really, it's about scaling athletic trainers, finding them in the right spot, putting them in the right locations, and getting them into these ecosystems as much as possible.
Cindy, you want please follow up with that, and part of what you see as the issue with why we don't have the access to athletic trainers at these events that we should.
So, this is on?
Yes.
Yes, thank you. There's not one size that fits all, obviously. So having, I'm a parent, being at a level of youth sports, I just came from another session that talked about sports for all. So kids who want to continue to play recreational sports all the way to adults, who continue to play sports. And then at the professional level, I'm the CMO for the National Women's Soccer League. And so we have ACL injuries, we have concussions, we have a lot of injuries on the field. That's a different scenario, right? So what are we going to do? What is going to be how can we meet the needs of athletes no matter what age and skill set? So I look at it as a lot of layers. So Jimmy talked about, and we talked about coaches, right? But sometimes the coaches may not have the time, be equipped. They're running from another job. They're a parent and they're doing it. So can other parents be part of the solution where they're also then going to be running the training, the warm-up ahead of the practice? Can we train them so that it's not just the frequency, it's quality? If the movement patterns are bad, it's not going to help. We know this in the research. Okay, so then we move on to that middle layer, which is the athletic trainers, which are the healthcare providers. I'm a team physician. So the middle layer, the healthcare providers, the athletic trainers, the problem is that we have implemented so much, in California specifically, but across the country, legislation, which is great. But every piece of legislation says if you have a concussion, you need to be pulled off the field, evaluated, diagnosed by a licensed healthcare provider, and then you can't return to play until you have a written letter saying that you're cleared to return to play by a licensed healthcare provider. In the state of California, athletic trainers aren't licensed. And what that leads into is that we know that with a concussion, the longer it takes to get diagnosed, treated, managed, the longer their recovery, period. Research is there. In terms of a knee injury, an ACL injury, the athletic trainer, if there's none at the field, if there's none at the tournament, if there's no one there, no parent who's a healthcare provider, we diagnose people all the time when we're watching our kids play. And they find out that you're a healthcare provider, they're bringing their kid to you, right? Liability aside. But what's the access? If you have a kid in an inner city school or don't have resources and they hurt themselves, it'll take them 4 weeks to get in. to get diagnosed, and then another whatever to get an MRI, and then PT, and then surgery. They're done for this season. They're probably done playing, right? That's the negative effect. The top layer I look at is professional athletes, professional leagues. What can we do? I'm also on the NFL Research and Innovations Committee. What can we do to implement things that will trickle down so that it'll influence everyone below it? And can we get superstars to be on social media? I am not good on social media at all. I don't check it that much, but you know, if someone comes out and they say, I tore my ACL when I was 16, and they're a superstar now in the National Women's Soccer League, or they're a superstar in the NBA, and they say, I have been doing my...
Diligently,
thank you so much, sorry. Diligently doing my program for the last 10 years, and I'm successful, and I have not hurt that knee or my other knee. This is what you all need to do to prevent it and to prevent it from happening again. That's who we need to get out there. We need to find those people to post, to tell them what their program is, and then have all these youth athletes saying, dang it, I need to do that too.
These are all awesome points. There's so many things I want to dovetail off of from that. But I'm going to start with this one. Holly, Cindy talked about, other people, a parent leading the workout, or even sometimes a kid on the team is being asked to lead a workout. Are the programs just as effective no matter who's leading the workout?
That's a great question, and we studied that. This is actually a funny story. So when we got our grant from FIFA to roll out the program, they had piloted it in Germany. And Astrid Young, who was the head of the development in FIFA at the time, she's like, well, Holly, you must roll this out and teach these people personally in the United States. And I said, Astrid, if I do that, the study's going to take me 22 years to complete. So we said, look, we're going to be a little avant-garde here, and this is 20 years ago now. And I said, let's create some webinars. So we had media, and we rolled it out, and we got stakeholders. So I, from a bit of nepotism, got my brother-in-law involved, Landon Donovan, Ante Razov, Bruce Arena. These were all very household names in the sport of U.S. soccer. And we got them to talk about how injury impacted their career negatively. So we know career loss, wage loss. We know career length is truncated by 50% in soccer, the NFL, and this is true ubiquitously. In Landon's case, he never suffered an ACL injury, and he talked to Cindy's point about how being diligent about his body, a la LeBron James, right? How when you put the time in off the court, off the field, that pays massive dividends. It keeps you available. And then from Bruce Arena's perspective, how do you coach around it? When you're going to the World Cup and one of your star attacking forwards goes down with an ACL, you have to pivot quickly. And what's the better option? Well, it's player availability. So one of the things we've gone to our coaches, because they said, okay, maybe I have to be more sales pitchy. Maybe it's not the science that gets people excited from a coaching perspective. So what if we talk about performance? So part of we did a Division I men's study to look at the efficacy of the 11+ program here collegiately in the United States. And we found, yes, it works. 72% reduction in ACL injury, 45% reduction in all injury, including concussion. Interestingly, 45% reduction in time loss. So if you are getting injured, it's less severe. But here's the winning carrot. You will win more and lose less. And I do think we do have a little performance benefit there. I do think that. However, it's because the players are available. When you look down the bench, it's deep. And that is what we want you to embrace. So part of coaching is player development. It's strategy. It's all of those things, but it's also player safety, health, and wellness. You are our ambassadors, right? You are on the field. They look up to you. There's trust, there's embodiment, there's all of those things, but you are also just as important as the tactics and the strategies that you implement to win. It's also to take care of these young people so that when they're our age, we can still play pickup.
Yeah. Yes, our age. Thanks, Holly, for reminding me. So we're talking a lot about coaches and coaches implementing some of these training programs. But Jimmy, you've looked at trying to get some of this infiltrated through PE. Can you talk about that a little bit?
Yeah. When we think about all the challenges of sport time, a desire to win, coaches who may be bankers or plumbers or, I don't know, any different profession, just volunteering to coach their kids. And we compare that to phys ed, where we have 12, 13 years worth of development opportunities. We have professionals who've gone through human anatomy courses, biomechanics courses, motor development courses. Like, what a great army of people to help us out with the development of these students. The schools that we've spent time in, I've probably been in more schools than the average person in any given year. The ones who have a great relationship between phys ed and athletics, those kids move well. There's a developmental system where those two are working hand in hand. So we've developed some lesson plans for phys ed teachers that we distribute through Shape America. Ours are focused on middle school predominantly, but there's a scary shortage of professional development opportunities for phys ed teachers. Do we have any phys ed teachers in the room?
Yay.
One? Yeah, one. I'll kind of describe what it looks like when you have professional development day, or when your kid has the day off of school and there's a professional development day. There'll generally be a giant staff meeting to start the day. Everybody has their bagels and fruit, at least in New York, they have their bagels and their coffees and everything. They'll go through some, like, these are our new policies in the school, this is our new cell phone policy, this is our new security policy. They'll do like these large group meetings, and then they'll say, all right, we're gonna break off subject by subject. So math teachers, we have a new math curriculum. English teachers, we've got a new book we're gonna be working on this year. Phys ed teachers, go do whatever you do in the gym. And they go and clean equipment and sit in their offices because there's nobody there to provide professional development. So we're trying our best to tackle that and get the information in front of these teachers who spend as much time in college on motor learning as they do on line dancing. Mm-hmm. And so there is an opportunity to provide some more information to them about these fundamental movements that they should be teaching.
That seems like a great untapped resource. I'm just curious for the group that's in here, obviously a lot of different backgrounds, but when I was still practicing in California before I crossed over to the dark side of media, I found that a lot of the kids I was treating, like PE classes, were getting reduced. Is that people's experience here as well? Because that's a frustration, because this is such a great opportunity to actually use physical education as a means of delivering this information. But I wonder, have you seen that?
Yes, we have. And I think it's that phys ed teachers need to prove their value. We can't roll a ball out and say we're going to play kickball today. We're teaching important life lessons. I mean, these go beyond preventing injuries. This is setting students up for a lifetime of physical activity and interest in healthy pursuits. This is way beyond teaching sports and exercise, all that. So to me, it's sort of proving your value, because I haven't used, I don't know, history in a very long time in a professional sense, but I use my body every single day. And maybe it's biased because this is what I do for a living, but I would think we would want most people in the country to be doing that, but we have to have a way to demonstrate our value.
I will. I'm from Berkeley. I mean, I'm from Ohio, actually, but I live in Berkeley, and I would say it's become an equity issue in terms of PE classes, because while there is still PE in the high school, here, I'll use this as an example, but I know, talking to other parents, it's changed as well. If you can document that your child is involved in an activity outside of the school or within the school, they're playing a school sport, which is great, and or they're outside playing a club sport, then they don't have to do a PE class. So then what you see on the field, because we'll go to the schools, is we have students who are brown and black on the field at PE class. So you can see it is truly an equity issue from that perspective, and then it's a greater social issue too, but how do we change that as well?
And just to hop on that, the opt-out clause, which I call it, is really disastrous to that individual, because then what happens, we have players, children that are selecting out to one sport at the ripe age of 10. That's absurd. That's why I have kids that are playing academy level soccer in Los Angeles that can't do a cartwheel. Their movement pattern is so myopic, and that's the beauty of PE. So if anyone remembers, again, dating myself, the Kennedy Fitness Program, right? We were so excited, like, yes, I want to win that. I'm going to do my pull-ups. I'm going to climb that rope. I'm going to do all of these things. And that's movement literacy. Let's bring that back. That was phenomenal. There was no class I enjoyed more. And I think that where PE has an incredible opportunity, because everyone has access to it, right? Yeah. Removes another barrier from a socioeconomic perspective.
So speaking of barriers, I want to go back to the one that is specific to accessing healthcare. And Charlie, I was wondering if you could talk a little bit more in specific about these alternative athletic trainer models that you've been innovating.
Working on, yeah. I mean, like I said, athletic trainers have been around for a long time, and certainly I wouldn't call that innovative. What I think is different now is we're hearing a lot of these healthcare disparities. Nationally, 45% of the kids ages 6 to 17 have access to what we call a healthcare home. And that's just consistent healthcare access. In California, that number's lower, and this is the average of 41%. And that's, unacceptable in my eyes. When we watched, say, a Juju Watkins go down last night, immediately game stops, the entire country's on it, including all the team doctors, all the athletic trainers, and they are in a real-time conversation over that athlete about what's going on. The diagnosis is happening. They are literally icing and working on some of those issues immediately. Where's that level of care for the kids in the country? And I think what's exciting about this particular summit is that we're here because over half the kids in the country, we're talking about 26, 27 million children, are participating in sport. If we're gonna solve some of our downstream issues, we need to be upstream with some of these ideas. The PE class in the elementary school is a great place to start some of that stuff. But when we talk about when injuries do occur, there's a lack of access to healthcare, and that is an insurance-driven discussion. When your child gets hurt, who do you go see? Typically your pediatrician, maybe an urgent care, or typically an ER. And we know that that may not be the right path of entry into the healthcare system, but it's decided by the insurance that the parents have. And so what we're trying to work on here is create models where not only do we provide the insurance, but we have the athletic trainer as a licensed medical professional outside of California, and we can provide them then essentially a referral into a healthcare system that skips the line. We want to get them that same type of on-site care and coverage that we know scientifically has proven to reduce the injury and recovery time, et cetera, et cetera. So for us, it is about making sure that there is an opportunity for having a home for a lot of these kids, having affordable $0 type of coverage that gets kids who don't necessarily have a general type or a very specific private PPO plan with their employer-sponsored healthcare plan for their family, something that can be utilized up to a certain amount of money that gets them immediate care, and then they can go into the healthcare system for some of those larger catastrophic types of injuries.
I think it's really important that this whole concept, because we can say that we know the importance of having an athletic trainer on the field, but even for a school that employs an athletic trainer, and I've talked to many of them, they're covering how many fields of practice at once, and an injury is happening on the backfield over here in one sport, and they're down here. Football usually gets priority, so they might be there, but you've got kids playing soccer over here and something else over there, and they're just the volume that they're asked to manage can be particularly overwhelming and still lead to some of the same issues. And we're not suddenly going to have a mass influx of athletic trainers. This is a multifactorial problem that we'll be carrying over into lunch. We'll talk about that. But I think we have to help educate families, schools, everybody on how you can get a child into the right line of care, which Charlie's talking about, is really important. Like, how much time is wasted on the recovery process if they're going to urgent care. And this is not, no disrespect to all the folks who work in urgent care, but you have to triage the really important stuff, and maybe a knee sprain doesn't seem like that big of a deal, and it's like, go home and do this and come back in 2 weeks if it's not better. But for a kid who then doesn't move and maybe something else was going on that should have been looked at, there's now a delay in accessing the proper care. So that's To me, that's what we're talking about.
And think about the timelines too. I mean, the interesting thing about this conversation is none of this is happening in a vacuum. So at the same time that we're talking about, well, they need to go to the urgent care, or somebody's got to pick them up and drive them and move them around, a parent's got to take off work too. And some socioeconomic communities, that is not an option. And so just back to Cindy's point, that entry into the right provider, right care model is delayed. And when every day you lose in that cycle is just worse and worse, and then we're talking about all of these long-term health issues that develop as a result, performance aside, this is about taking care of and using the opportunity to have such a massive population. How can we improve a lot of our country's issues around healthcare in this environment, and using that as an entry point into the solution?
Did you want to?
Oh my gosh, yes. Lovely. I love my panelists. They say such great things, and I sit here and I'm incorporating it all. And I will say, for those of you who have been in the school system, who are an athletic trainer, who are a team physician, I've been a team physician in high school throughout my career, and I will tell you that the kids come in, that becomes their medical home. They come in and they talk about an argument that they had. They talk about something that happened in math class, and that becomes their safe place. And there is no better feeling than seeing those relationships develop within the training room in the high school for Cedars. So they can fill that gap. But the other thing I want to say is parents. So I have 2 children. One played professionally in a sport. And I will say that parents are scared to talk to coaches because they're afraid of what that's going to do to their kids' status on that team. But what we have to do is we have to translate these statistics, these percentages, move it from the discussion of athlete exposures and percentages, and just say, you have 4 kids on your team that over the next 5 years are going to tear your ACL. And if you do this program, you're going to prevent 3 out of 4 of them from tearing their ACL. I mean, I think that we have to not dumb it down, but you know what I mean, simplify it. I'm using all the wrong phrases today.
We're here to help you.
Simplify these numbers so that they can actually tangible. Remember when, for those of you who teach, there's 4 baseballs on the field, and if you take away one of them, how many do you have left? 3, right? This is how you teach math concepts. Same thing with the coaches, with the parents. If you do, on my daughter's competitive club soccer team, 5 out of the 18 girls had already torn their ACL. We have to use that as a visual, and then get the parents on board. So translation of science into the media, Stephania, media, right? Cameras. We have to translate it into the media. We have to translate it to the parents, to the healthcare providers, to the PE teachers, to all the stakeholders. That's what we need to do.
Yeah, and the other thing too is that this is, clearly it's not a major priority. What we talk about in all of our sessions, and we go to all these conferences and we talk about the competitiveness or how to run your business around sports, where is the discussion around these types of issues? And it's just not. And for me, honestly, what that feels like is that these kids are disposable to the system. There's how many other kids are coming right up behind them? And it doesn't impact us because it's not our kid. But when it is, changes our life. And we've heard from a lot of the panelists before, and we hear from this panel, that could be the end of their career athletically forever, and certainly could shorten their lifespan. These are the types of issues that, are long-winded and not necessarily short-term.
But they're important, and one of the things that Charlie just said I think is really important because it comes back to what I referenced about mental health issues for athletes when they have injuries that are this severe, and they could be young. We're seeing 8, 9, 10-year-olds tear their ACL. And I know we keep using ACL, but I'll use another one, like Tommy John, these kids who are pitching too early, and then all of a sudden they're out, and it's not even just get it fixed and move forward. Their bodies are still developing. That's part of what makes the issue that much more problematic, is you're trying to fix something artificially, synthetically. Thank goodness we're able to do that, but they are still developing and growing bodies, and how is that going to influence how their ability to participate in sports, because they're trying to develop post having one of these injury interventions. So from the toll that it can take mentally on these athletes, I think people don't realize how many kids don't return to participate in sport after a serious injury because of either they've lost interest because they've been away so long, and there are various different things, but also fear of re-injury is a big one. So they're afraid to come back, or fear that they will not be able to return at their prior level of performance. And that doesn't get talked about or addressed enough. But I think as we're educating coaches and parents about how, the importance of implementing some of these strategies, if they thought they were going to lose, like your math example, it's not just for the short term. Like, you might be losing them for the long term, and they're going to be discouraged about sport. So that carrot of keeping kids, we're talking about keeping kids participating in sports. How do we translate that, any or all of you, to get people to want to buy in, because it's going to continue that participation?
Yeah, I kind of think that if we follow what happens at like the professional level and college level, all the resources that are available, all the load management that's happening now, all this stuff, it's a few years ahead of the youth sports world, but I don't think it's that far ahead. And I was listening to a podcast last week talking about youth baseball players and comparing it to Major League players. And Major League players are all wearing the Whoop or the Aura or something like that to track their readiness or their load. And they said, well, it would be crazy if we had kids walking around with Whoops on. And I thought, like, I'm not an ambassador for Whoop or anything, I can wear one. But what's crazier? Having a kid, like, we're tracking how much work they're doing and telling them to pull back a little bit, or trying to sneak our way around pitch count rules? Like, if we're thinking about the future of sports and we have this technology that professionals are using to keep themselves healthy, extend their careers, why wouldn't we want that to find its way into the hands of kids? Like, if sports, like psycho sports parents were saying, my kid needs to do less, I think we would all agree that's a good thing. So, like, let the parents be crazy. Let's just teach them a new way to be crazy,
Let's give them something else.
Yeah.
Redirect that.
Yeah.
That's a great point. And I think, like, whether it's Tommy John or ACL, these have become normalized. It has now become a rite of passage. And that literally strikes terror in my heart, because this is not normal. I remember talking to Jimmy Andrews at a conference where he's a well-known orthopedic surgeon who essentially was one of coined the term Little League elbow. And what was happening when he started his career, it was like he was just doing Tommy John repairs on professional players. Then it became collegiate players, and then it became high school players. And the data is really compelling to look at the number of MLB pitchers, who have had Tommy John. It's almost looked at from not our world, but like, oh, it's reinforced, so it's a good thing. That is not true. The injury shouldn't have happened in the first place. Or the number of pitchers that are currently in MLB that pitched at a young age. That's an incongruent statistic. So essentially, if you start too young, you're not going to make it that long. So we have to stop normalizing that injury is just a rite of passage, particularly the catastrophic ones.
And I think back to Jimmy's point too, there's a lot of great models and technologies and new science and ways of thinking that are protecting the assets that professional organizations have in their athletes. For me, I don't know why that doesn't apply to children. I mean, that is, in my mind, the most important asset. And back to we were talking earlier too about these disparities. I mean, we've tracked kids in our reports through the Injury platform. We had a kid, it happens all the time, I should even say one, but there was one child where had a suspected concussion. That child was flagged red for the rest of the season, and then the next season was starting and they were still red, and we reached out and inquired what happened. Family dropped out, didn't have health insurance, couldn't go to the doctor to get a clearance for a concussion return to play. Stopped playing, probably went to another club, started over there. How many times is that happening? So I think these are the models that we can look at for setting the stage and how we lead by example and then apply them, to the youth sports model to help solve some of these problems.
I'm sure. I could keep asking questions, but are there questions in the audience? Because if so, I'd like to open up for Q&A. And Dr. Mandelbaum, if you'd come up and join us again. So we have the microphone going around, and if you wouldn't mind when you ask your question, tell us who you are and who you're with, so we have an idea, and you can direct it to anyone up here you like.
Well, first of all, thank you for bringing up everything that you brought up. My name is Karen Marley. I'm from Colorado State University in Pueblo. I teach future teachers in physical education, motor learning. And thank you for bringing up that physical education is an important piece of this, because the realization is that PE is just play and go have fun and do nothing else, where in reality, what we are teaching is exactly what you have recommended, functional training to keep kiddos from getting hurt later in life. And I think my perception is that if we had more professional athletes, more doctors, more people in your field promoting what we do on a regular basis, it would decrease those numbers of injuries, and it would also validify, so to speak, what we do in our profession so that you don't have to do it in yours. And my question is, can you help us, and can you speak louder to the public? And it will take years, because we've went from sampling all kinds of things in physical education to now specializing in PE, which we don't want to do. So basically, can you help us?
Yes.
Yeah, of course.
You want me to talk louder? Just kidding.
Yes, you do amazing work, and it sounds like Colorado students are in a very good place thanks to what you're doing. I would say the other great angle that we hear all about at this conference every year is multi-sport play. And what a better venue for multi-sport play than phys ed, because you don't have to buy the equipment if you're a mom and dad. Let the town handle it, and it can be in the school. And you could be a highly specialized soccer player who happens to play team handball and softball and lacrosse and swimming in phys ed class, and all of a sudden you're a multi-sport athlete. But yeah, thanks.
Oh, yay. I love questions. This is great. Yeah, go ahead to whoever. I didn't see who is next.
They all went up together.
Yeah.
Hi, I'm Matt Coyden. I'm CTO of a company called Breakaway Data. Actually, we're trying to empower athletes to own and bring together all their data, kind of like what you were talking about. And we're currently working with professional athletes, but starting to do a lot more in the youth space as well. The idea that if you have more data about how you're performing, you can make smarter decisions about your performance, about your health, and everything else. I'm also a dad. I got two daughters that play, one of them plays soccer. And I was kind of curious, we heard the stats up front about the increase in the ACL injuries, particularly around girls and women over the last number of years. And I remember reading a book a few years ago, I think it was called Up to Speed, and it was about, one of the premises was kind of this idea that a lot of the research had been done on boys and male athletes, and it's not a just direct application to say, oh, this is what we learned from studying boys and males, therefore it's the same for girls and women. And I'm kind of curious, how, in your experience, how does that factor into kind of what's going on with these injuries? And it kind of the takeaway I was getting from this was a little bit that we kind of know what to do, we just need access and more people to do it. And I'm kind of curious, is that the takeaway I should have, or are we still trying to understand, particularly with girls and women, exactly what we need to do to kind of help them be healthier as athletes?
In 1999, 21 of us spent 3 days in Hunter Valley, Maryland, looking at all these things. We looked at the anatomy, we looked at the hormones, we looked at fields and shoes, and we concluded, the consensus was, and we published this, that it was really this neuromuscular difference that was between males and females. And hence, we focused on that. We focused how young girls look like a giraffe coming out of the womb. Just look on that field, on the left side and the right side, where the boys are dodging around with their knees bent, and the girls look like that giraffe with their knees and her legs like this. We call valgus. So the programs that we developed were to help our females in the field of battle. Again, when Pierre de Coubertin had brought back the Olympics, women were barred from the Olympics. So we also have to understand, since the 70s, we now are dealing with this problem anew. So we have to develop the concepts, the technique, and the technology to correct it. And that's what the prevention programs are focused on.
But an irony of ironies, we began in the female space. Our first studies in the 2000s were on women. And the criticism I would get when I would go to AMSSM and speak, we're like, well, where's your male data? Shocking. And it was a flip of the script, because that never happens, cardiology, it's all male-dominated data. And that was what was so troubling to me when we were going to the World Cup, the Women's World Cup in Australia and New Zealand just last year. Are all of you familiar with the Ballon d'Or? It's the best. It's awarded to the best player, the best soccer player in the world. And there were 10 nominees, male and female. Of the 10 female nominees, 5 were unavailable for the World Cup due to ACL injury. That's unbelievable. Could you imagine if that happened on the men's side? You had Rodri out, and I mean, it would just be, it wouldn't. The media would be all over that. And it's like, so I think what we're dealing with, the data's there, and the data started in the women, which I'm super proud about, but the awareness and the adoption is not there.
We started this with Stephania telling us about Juju Watkins last night. But how about the next Juju? How about our daughters? How about our neighbors' daughters? We've been talking about this, Holly and I, for 26 years. And you asked for help. I'm going to put it back on all of you. Help us. We need to globally implement this in an efficient way. The Aspen Institute, through Project Play, has given us that opportunity. We do have a coalition. We do need support. We need it on every level. It has to be a village that it takes.
Neuromuscular development, free play. So what we're trying to do is develop standards in our league in terms of minimum standards for athletic trainers, years of experience, performance staff, team physicians. Without a doubt, the men's teams get all those specialty staff with a lot more experience. The women's teams get the staff with minimal, less experience. Pay structure, better gear, better swag. That's one issue, right? We're trying to improve that, right? We're trying to make it sexy, that's a bad term again, but attractive to come into the women's league, right?
Regardless. You said that.
Yeah. Sorry. The other thing is free play. So when I was growing up, I went out and I played all the time with my brother and his friends, right? But I was a tomboy and it was not looked well upon. And as we go transition, still if you look, who gets strength programs, who gets training, boys teams, not the girls teams, right? This hopefully is changing. So the data may be different. It may be different in 20 years. We don't know. But what can we do, what can you do is demand the level of care and attention, scrutiny, et cetera, to all kids, regardless of gender, to all kids.
Yeah, what you're hearing too, you have an all-star panel here. This is like, the starting cast of the 1956 Yankees up here when it comes to injury prevention and ACLs. And you're hearing them say is, we've been talking about this, nobody has been listening. We have a marketing problem. You're seeing an explosion in flag football right now. You're seeing girls playing, one of my daughters plays right now, and loves it. And it's growing so rapidly that it's an organizational efficiency issue. No one's thinking about how do we protect the kids. Again, are they disposable? Do we not care enough? because we're not going to stop having kids. They're going to continue to play sport, especially in this country. We have the answers. We need to get the answers out, and that's where help.
Medical priority at all of my levels. Bert will say the same thing, because internationally, prevention is at the top. In our country, prevention has never really been top, right? Medical in all organizational systems is something that people have to have, but they don't want to have, but they have to have it. And so when we try to implement these things, like the funding, I was actually told recently, I understand you need more funding, but you don't bring in revenue. So you're a loss leader. I'm like, what? I actually said more than that, but in my mind.
Mission appropriate today.
I know. I get that might shock everyone, but.
But I think this is a really good point made, is unfortunately our business model of actively pursuing prevention in our respective communities is really a problem, that we have to overcome it. We have to figure out how to incentivize our parents, our administrators. On U.S. soccer level, George Champus is leading licensure. Coaches are going to have to do prevention as part of their licensing. That's another step. We have the ACL Injury Coalition that's going to help us. Another step. But we need to activate the village. And I think part of this session, the purpose of it is really to get you up to snuff and to help us help you.
Are there any legislators in here? And that's the problem. Right? That's the issue.
Yes, please. We love the questions, so keep going.
How you doing? Andre Parker from the Mac Parkman Foundation. You kind of touched on it a little bit. I'm not sure which one mentioned, but concussions and concussion protocols. Is there more information when it comes to, because to me, and what we kind of promote is, it's always a reactionary. Where's the preventative of the concussions? The repetitive hits lead up to the concussions. And what we're saying is, where is the information and where is the outcry in the age of first exposure when it comes to youth playing whatever sport? Football is kind of the main thing, but concussions happens in every sport, as you all know. Where is that information coming? Why is it not coming down from FIFA when it comes to heading and the youth heading the ball? Why is it not coming from the NFL and their concussion protocols? And so I just had what your opinion is on that.
Well, I'll answer it briefly and hand it to Cindy, but I think we are. U.S. Soccer changed the rules 6 years ago in terms of 12 and 13-year-olds not hitting the ball. Changed the size of the ball, changed the protocols. 10 years ago, the MLS had a protocol that included 0 data in a slide, but is now a very comprehensive approach, as we do in the NFL and the Women's League as well.
Well, just an update about SCAT6, but also, I'm proud of what soccer's done, because there have been rules changes to help support. Also with some of the training. So when when there's purposeful heading, I'll use soccer as an example. When there's purposeful heading, we can mitigate risk. If you're hitting the ball and not letting the ball hit you, we can change the torque relationship there, right? So that's where the core and neck flexors come into play, and that's all built into our programs. So we're designing things to be protective. There's some concussions we cannot prevent. I'm fully aware of that, but we have thought about all of that, and again, removing obstacles. But I think from U.S. Soccer's perspective, changing the rule, decreasing the access or the prevalence of heading, and making that more age appropriate when you have the physiology and you have the neuromuscular control to do it optimally and mitigate that risk.
And Brian from the CIF can help support that. So the state of California passed a law several years ago saying that 26 sporting organizations, if you participate in 26 sports, equestrian, rugby, etc., And outside of the high school system, you have to have information given to every parent about concussions, symptoms, signs, etc. And then if you have any symptoms and you suspect in your child or the coach sees it or whatever, they have to pull them out. They have to be evaluated, diagnosed by a licensed healthcare provider, and they can't return to play until there's written clearance by a licensed healthcare provider. It mirrored the state high school law, which turned into Ed Code for high school students in California. So these attempts have been made to educate about concussions at the youth sports level. I will tell you that, yes, soccer, we're constantly evaluating rules, etc. Football, you don't think NFL is supporting flag football? I mean, they see that there's legislation happening across the country about trying to restrict heading or contact football at a certain age, right? They're not silly. They've got a whole legislative arm. So flag football, they're promoting. Why? They want to continue that interest in football. So I do think that people are paying attention, but the fact is that everyone, when you talk about stakeholders and people who want to ban this or eliminate this or stop heading, or believe me, we hear it. The question is, how do we take all that information? Because science, 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 science. We have to do more science. We're starting a research commission in the NWSL. We do have it in the MLS. I mean, we're starting more science because that science that we're able to publish will go down and help. Because we have to have science over hype. There's a lot of people out there that want your money, and they're gonna say, wear this headband, it'll decrease concussions, right? They're gonna make a lot of money off of it, but where is the science?
Do you have a registration platform that you use for your waivers when people come in and they sign, they check the box for the concussion education stuff? Right. Problem there is that we're missing the opportunity for true education. When it's a checkbox, or it's a piece of paper that I'm supposed to read as a parent to sign my kid up, and then I got another practice I'm supposed to go to. I don't have time to do all this. We're missing the opportunity for education and for prevention by just providing a CYA type of checkbox method. There's opportunities there to increase the knowledge. And what you're hearing here, again, I keep saying the same thing, guys. We've been doing, these people here on this stage have been doing this for decades.
Lots of
lectures. This is not
lectures.
new information, right? So how do we get this information that they have scientifically validated and educate parents and coaches in your community? There's the gap. Marketing, marketing, marketing.
Media, media, media.
I'm just going to move on, get a couple more questions answered before that.
Jessica, I'm an athletic trainer at Shriners Children's in Portland, Oregon. I'm working in the sports medicine department, adolescent sports medicine. This panel, this topic, I think it really leads the way with the path of 6330. If we retain our kids and prevent these injuries or get them back to youth athletics, if the number 1 and 2 cause of dropout is injury or burnout, and I kind of want to pivot to the not as shiny ACL, but those overuse conditions and monitoring workload on return to sport and being really imperative to retain those athletes and do the things that they love. I just highlighting that the research is out there, but dissemination of research is really imperative to what we do as a group, what everyone up on the panel is doing. So I just want to commend and highlight that. But burnout, the American Academy of Pediatrics has a great list that's really easy to see of my kid is a perfectionist, or they don't get enough sleep, or you're identifying things that they're struggling in academia to say that this is a ticking time bomb for them to burn out and then stop playing sports. And that number of kids in youth athletics is going down. And so I kind of asked the panel, with the CDC mandated the heads up training, how do we get them or an organization to start mandating this education of coaches and parents to how do you identify the burnout in your kid to retain them in sports?
that Cindy touched on it before when we talked about the same type of issue with legislation and how there is a ton of legislation that's out there right now. One of the problems we have, and it kind of goes back to the other question, is that we don't have a centralized government system that oversees all of our sports in the country. And so where is the one place where we can put this information and research in, and then it just spits out on the backside and goes into the society? There isn't one. So we have to work through each individual NGB channel to get them on board. And then we also have to cross-reference that with 50 states and their legislation. So it's not an easy process right now, as the way that U.S. sports are built, to actually solve for these problems, which is part of the issue that we're trying to solve for right now.
I will say to the American Medical Society for Sports Medicine, of which I'm a member and past president, if you go on that website, I know it's a mouthful, AMSSM.org, and you put in your zip code, there'll be a whole bunch of doctors that are trained in sports medicine, primary care sports medicine. The reason I'm telling you this because of this. We've all given a lot of talks, and we'll talk to groups of 20 people, but boy, I would love to talk to an auditorium of 1,000 people. So if you as an organization operating in your zip code or your region can get together with other sports organizations, youth sports organizations, and say, hey, let's all bring our parents together, our coaches together, whatever, and let's pack this auditorium to hear this speaker talk about these 3 top topics. That's how we're gonna do it. But I tell you, we also have overuse, fatigue, burnout, because we're constantly being asked to speak and talk. And listen, we would love to do it. But what we have to do, this is just a simple solution, perhaps, to being able to get someone who's trained, experienced, et cetera, to your local community to educate parents and everyone at one time.
Obviously, everybody in this group is super passionate about this topic, and I really appreciate all of you that have come, but we're running close to lunchtime, and we do not want to keep you from lunch, but don't leave just yet, because there's a couple things up here. You can download the field guide that's been put together by this partnership group with the National ACL Injury Coalition. So if you scan the QR code, you can have access to that. This is, out there, brand new, but go ahead and utilize this, and please help spread the message on this, because if you've heard nothing else today, you probably heard that we need more people to be the advocates out there besides just, 5 people up in front of the room. Also, there's a lunch that's going to be happening today, the Athletic Trainer Advocacy Lunch, specifically, this is Cindy's project here, talking about what the current state is of athletic trainer licensure and the challenges with that in the state of California. That's going to be just over on the other side of this floor here in Pauley West. You can pick up your lunch from the plaza and then go over there, and you're going to hear some of the experts talking about some of the legislative issues. And then don't forget to, at the session in the app, you can have an option to fill out the survey. It'll just take 2 minutes, but it's really important for the Aspen Institute to get feedback about the panel today. We hope it was helpful. I want to thank all these wonderful guests. It's so great that they were here. You're hearing from the people who designed this stuff. That's amazing. So thank you to all of you, and thank you.